Hi, I'm Hillary Talbot, acupuncture physician and clinical herbalist, coming to you from Acupuncture and Herbal Therapies. Today we are going to be discussing effective acupuncture points during maternity. Now, if you're pregnant, it's really important to understand which points are appropriate for you during this special time, as many common pressure points are contraindicated because they have a down-bearing action and can actually promote false labor or actual labor. So if you don't already have an acupuncture physician, I encourage you to seek one out on acufinder.com and to look for someone who's experienced in treating pregnant women. 2 points I'm going to show you today are very effective during the first trimester. The first will be Kidney 21 to help resolve nausea and vomiting. Now, most of us know the anti-nausea point located on the wrist, but I find in pregnant women that Kidney 21 is actually much more effective at reducing nausea, especially in the first trimester. And you can begin each morning before getting out of bed by massaging this point to help alleviate any morning sickness. Now, Kidney 21 is located on either side of the xiphoid process, which is this little kind of knot at the end of your sternum where the ribs come together. So to find it, I'm just walking my fingers in on the edge of the ribs up to where they meet, and then I'm going to use my thumb and my pinky and gently press down in this area. While you're doing this, it's also doubly effective if you take nice deep breaths and imagine all the energy in your body going down into your uterus and your belly instead of rushing up into your throat. Visualizing this while taking some nice deep breaths and applying a little bit of pressure for even as little as 3 minutes every morning can help alleviate nausea. There are lots of other things, lifestyle choices especially, that can help alleviate your nausea, like the exclusion of dairy at bedtime. Now, another point that I like to teach all of my pregnant moms is Do 20. It's at the top of the head, and it has a very upward bearing action. So this point would be very critical if you experience recurring miscarriages or you have a threatened miscarriage, or perhaps you're under a lot of stress and you're worried about losing the pregnancy. It's also effective at giving mental clarity. So if you've ever been pregnant, you know that there's kind of a mind fog that happens. So to find this point, you just locate it by using your fingers at the top of the ears until your thumbs come to the vertex or the top of the head. Kind of place your finger there and then trace your midline all the way back until your fingers meet. Now, if you search around with your finger, you'll often find a divot there, and that is Do 20. And you can stimulate this point with just a little bit of circular pressure, but often what is really effective is just tapping. So using your finger and tapping on the point while taking some nice deep breaths. Again, this encourages an upward action of the qi to help with symptoms of threatened miscarriage, as well as clearing the head. As I said before, there are many acupressure points that are effective during pregnancy, but there are also many that are contraindicated. So it's important to understand which ones are right for you. So I encourage you to contact your local acupuncture physician skilled in treating pregnant moms. I'm Hillary Talbot, and that was Acupressure During Maternity.